Hey, and welcome to the Ecolab Food Safety Matters webinar, Employee Safety. We have several housekeeping items before we get started. If you experience technical difficulties with the WebEx session, you can contact support toll-free by dialing 866-779-3239, or you can message the WebEx producer using the Q&A panel, and I'll be happy to provide assistance for you there. All participants will remain in listen-only mode, and as a reminder, this event is being recorded for rebroadcast. We can submit written questions at any time during the presentation. Use the Q&A panel located at the bottom right of your screen. Type your questions in the space at the bottom, then hit the send button, and please be sure to direct your questions to all panelists in the Ask menu. You will not be seen by other members of the audience and will be addressed, time permitting, to the end of the presentation. I'm pleased to turn the call over to your host today, Karen Bacek with Ecolab. Karen, over to you.
Thank you, and thank you everyone for attending today. As Kirk mentioned, our topic is keeping your workplace safe for employees and guests, and our guest speaker is Cindy Rice. Cindy is a certified safe instructor with a BS in biology from Bates College and a Master's of Science degree in public health from the University of Massachusetts. As an epidemiologist and researcher with numerous journal publications, she is also a registered sanitarian, NSF certified HACCP manager, certified professional in food safety, and NEHA certified environmental health technician. With that, I will turn it over to Cindy to provide us with some information about workplace safety. Cindy?
Thank you, Karen. It's a pleasure to be with you all today. Restaurant kitchens are a virtual playground for workplace hazards. These can be very costly to industry and also impact the safety of employees and our guests. Today, we're going to discuss the different types of hazards that exist in a food service operation and preventive measures that we can put in place to help control these risks. The goal is, of course, to keep a safe working environment for everyone. According to OSHA, there are a whole range of accidents that occur in restaurant kitchens. Most commonly, these include burns, cuts from knives or slicing equipment, slips and falls. Occasionally, an employee or even customers may become sick at the facility and vomit or release other bodily fluids in some area of the restaurant, whether the kitchen, dining room, or restroom. The accidents can also expose people to dangerous pathogens. Most concerning in the industry today is Norovirus. The National Restaurant Association estimates that the average cost of an outbreak is $75,000, and many restaurants that are involved in an outbreak never recover. I think we'd all agree that an outbreak situation such as this can be catastrophic for a restaurant, especially a small operation. So we will discuss ways to prevent norovirus contaminations in food service environments and cleanup a little later on. Workplace risks in your establishment can be beneficial to everyone. Of course, for employee injuries, result in lower workmen's compensation costs. Guest safety and uninterrupted operations are a huge benefit. Avoid the cost of an outbreak and reduce legal fees. Minimizing exposure to workplace hazards will result in a safer work environment to all and ultimately protect your brand. The first type of accidents in food service operations: slips, trips, and falls in restaurants. These types of injuries account for about 30% of injuries across all food operations, according to the NRA, National Restaurant Association statistics. And slips and falls cost the industry over $1 million each year. Slips can happen wherever there is too little friction or traction between footwear and the walking surface. And as you know, in restaurants, common sources of slippery floors include in the dishwashing process, overspraying or off in the dishwasher area, equipment or pipes, and spillage from transporting open containers, such as those holding flated grease or food waste. cleanup procedures and safety precautions at work can help prevent slips and fall injuries in the restaurant industry. Some good practices in this area would include having a regular cleaning schedule, eliminate cluttered or obstructed work areas, use caution signs when mopping or when floors are wet, non-slip floor matting that are clean and dry and secured in place, such as shown in this picture here. Of course, cleaning up spills and splashes immediately to reduce exposure to these fluids to employees and guests. And staff or management should conduct periodic inspections of the restaurant to correct any slipping and falling hazards that exist before accidents happen. Slip-resistant footwear on employees could also help minimize accidents in the workplace. Another include cuts, lacerations, and amputations, common risks in restaurant environments. These commonly occur from knives or other slicing or chopping equipment. These injuries most commonly occur to hands and fingers, and one California study actually found that 8% of all restaurant accidents involve an amputation of sort. Amputation sounds kind of drastic. It may be a fingertip or possibly something more severe than that. And the potential for injuries are especially high if staff are not properly trained in the use of knives or other slicing equipment. As a result of cutting accidents, blood can cause some dangerous exposures. They may contain dangerous bloodborne pathogens such as HIV or AIDS, hepatitis B or C, and this blood exposure can be a risk to other employees or customers. Cutting injuries can be reduced by implementing some simple strategies in the Use non-slip cutting boards with gripping corners or edges is hugely beneficial. Keep knives sharpened and use them only for their intended purpose. Properly dispose of broken items such as glass or brittle plastics, and use personal protective equipment in handling broken materials if such accidents do occur. Knives stored in knife racks or knife sheaths close to areas where they are used. When cleaning, knives should be cleaned immediately after use by hand, and avoid putting knives in the dishwasher where others could reach in and cut themselves, so manual cleaning of knives is recommended. Resistant or steel mesh gloves are extremely helpful to prevent any slicing injuries. Deli slicers are a big source of cutting accidents, and so steel mesh gloves can be very helpful. At all times, an employee should be in control of his or her knife blade or her body and the food they are cutting. Of carry knives with the point down when walking across the kitchen, and keep the cutting edge away from your body. Just some on knife safety. Emergency or an accident. Good practice would include immediate and proper first aid treatment at the site, and immediate treatment can decrease the severity of the injury. It's really important to have first aid materials accessible and conveniently located, and first kits stocked appropriately. A lot of people ask, what are the first aid requirements for restaurants? What kind of first aid kit do I have in place? According to OSHA regulations, every restaurant is required to have a first aid kit easily accessible. It should be stocked with specific supplies, and these stocking requirements are based on standards, ANSI and ICA standards. These ANSI standards set minimum performance requirements for first aid kits. OSHA considers the restaurant industry to be general industry. And in this case, the assortment and quantity of first aid supplies should be able to deal with most types of injuries and sudden illnesses encountered in the workplace. These would include supplies for major wounds, minor wounds such as cuts and abrasions, minor burns, sprains and strains, and eye injuries. And you can see a kit here that's typically appropriate for a restaurant operation or a food service. Scalds are a leading cause of occupational injury in the United States, and about 1/3 of workplace burns across the country occur in restaurant operations. Scalding burns are caused by coming in contact with hot liquids or steam, but burns and scalds can also occur from hot oils, fryers, ovens, and other cooking equipment or sheet pans. With hot oil are generally more severe than those from hot water because, if you think about it, oil heats to higher temperatures and is thicker than water, so oil may remain on the skin for a longer period of time. Scald hot water are also very frequent in industry, and third-degree burns occur almost instantaneously if water reaches boiling or simmering temperatures between 185 degrees to 212 degrees Fahrenheit, which of course is boiling. By comparison, hot beverages served in restaurants are between 160 and 180 degrees Fahrenheit. These burns and scald type of injuries can be reduced with some simple strategies. First of all, is very important. Taking proper precautions when working around fryolators, hot liquids, and cooking equipment. To be really careful when transporting hot liquids to not spill them or splatter them along the way. Care should be taken when placing moist foods in fryolators or foods with ice crystals that tend to splatter grease when the ice or moisture comes in contact with the oil. Staff should understand not to mix water and hot oils. Do not handle hot pans with damp cloths or damp oven mitts. And of course, wearing long pants and sleeves in the kitchen is a good daily practice. Avoid burns and scalds. Equipment is critical to help prevent burns and scalds, especially when doing certain tasks. Oven mitts and thermal-resistant gloves that can withstand temperatures of up to 400 degrees are very helpful. Steam gloves are also extremely helpful if working around steam or hot liquids. Temperature grill cleaning tools such as bricks or scrapers that are equipped with long handles can help prevent burns in employees who are cleaning grills or working around grill stations. First aid material should be conveniently located, either mounted on the wall or in an accessible location. First aid treatment at the job site can decrease the severity of a work-related burn. Basic procedures would be to flush the area with cool water to cool and clean the burn, cover burn, and seek medical attention if necessary. Eye is a common concern in restaurants. Eye injuries can occur from splashing chemicals during cleaning, or while mixing chemicals or sanitizers, handling degreasers, or applying toxic substances. Injuries can also occur from grease splattering during cooking or operating a fryolator. Preventable in these cases, such as wearing safety glasses and goggles. Also, having eye wash kits accessible, stocked with proper supplies for a continuous flush is very important in treating an eye injury immediately. This one shown here can be used for both eye and face flushing. And training staff on using eye washes is critical so that proper treatment can be administered immediately and then seek medical attention if necessary. Someone may be sick with vomiting or diarrhea in the facility, whether this be a customer or an employee. Of these bodily fluids in some area of the restaurant, either kitchen, dining room, or restroom, can expose people to dangerous pathogens. As you know, in our industry, we're most often concerned about the risk of norovirus transmission. Norovirus infections. Norovirus itself is the leading cause of foodborne illness outbreaks in the United States today, according to the CDC, the Centers for Disease Control. About 3 million people get sick every year from norovirus infections, and it occurs mostly from close contact with affected persons or eating contaminated food. Norovirus, by its nature, is very contagious, and outbreaks can easily occur anywhere people gather or where food is served if we're not careful. Food workers cause about 70% of reported norovirus outbreaks, mostly through bare hands contaminating ready-to-eat foods. Symptoms of norovirus include vomiting and diarrhea, but many infected persons show no symptoms of even being sick, which makes controlling norovirus especially challenging. Another challenge in preventing norovirus infections in service operations are that food workers often go to work when they're sick. Whether they're symptomatic or asymptomatic, they showing up sick at work and then can consequently contaminate foods. Here are from a few studies. One study showed that 1 out of 5 food service workers reported working while sick with vomiting and diarrhea. 30% of food workers admitted to not washing their hands after using the restroom at work in another study. 54% of outbreaks, norovirus outbreaks, were judged to be caused by infected food workers touching ready-to-eat foods with their bare hands. And as you know, ready-to-eat foods are those that will not undergo any additional cooking or washing, which would normally reduce microorganisms. These would include fresh fruits, salads, cooked vegetables, baked goods, pastries, or other items that have already been cooked. And some other studies have shown that hands of food workers are only washed 1 out of 4 instances when they should have. Norovirus infection usually displays symptoms of severe vomiting and diarrhea. The fecal matter and body fluids contain these pathogens and can easily transmit them to surfaces, foods, and other people. If it has a norovirus infection, they typically shed billions of tiny norovirus particles in the stool and vomit. In fact, 1 gram of fecal matter contains about 10 million norovirus particles, about the same number of stars in the Milky Way, which is huge. And norovirus is extremely infectious. As few as 18 norovirus particles is enough to infect an individual, either by ingesting contaminated food or inhaling the airborne particles. Think of this. If someone throws up in your facility, sorry to be kind of gross, their vomit particles can become airborne and spread to a 20-foot radius around the point of impact, infecting anyone who may come in contact with those norovirus particles suspended in the air. Also, norovirus survives in fecal matter up to 2 weeks after symptoms are over. So norovirus, the point is extremely infectious. Norovirus is so threatening in the food service industry, there are some federal regulations around vomit and diarrhea in food operations to protect against norovirus transmissions in the restaurant environment. The FDA 2013 Model Food Code has a couple of provisions to help cut down norovirus transmissions in retail food establishments. First of all, section numbers of the food codes are shown here. 2-201.12 requires food workers with symptoms of vomiting or diarrhea from an infectious condition be excluded from work completely until they're symptom-free for 24 hours. And this is, again, to cut down the risk of norovirus transmission from ill food workers. Food employee reporting agreement for employees can help ensure that managers are notified of these symptoms and illness and can reassign workers tasks accordingly and exclude the ill food workers when necessary. All retail food establishments must have written procedures for handling vomiting, diarrheal accidents to minimize the spread of contamination and the exposure to employees, consumers, foods, and surfaces. These written protocols would include having cleanup procedures for vomiting and diarrheal accidents. Proper cleanup materials and procedures to be in place might include a biohazard spill kit or materials for cleaning these human bodily fluids, vomit and diarrhea, and fecal matter. Materials and spill kit should be conveniently located and accessible. Ideally, these will be wall-mounted for quick access. Procedures for cleaning up these bodily fluids: immediately block off the affected area, have a mop, bucket, and tools dedicated for cleaning bodily fluids. Personal protective equipment should be worn, including gloves, a leak-proof apron, and/or eye protection to protect the person who's actually doing the cleanup. And as you see in this picture here, using disposable absorbent pads or powders and a disposable dustpan can help soak up the liquids, collect it in a disposable dustpan, and disposed of in a safe way. After the liquid or the substance, an appropriate chemical solution for disinfecting norovirus should be applied, such as this EPA-registered disinfectant. Also, some people ask if chlorine or quartz is effective in killing norovirus. Ammonium will not kill norovirus. It's not effective, but a very strong chlorine solution would. In fact, 5,000 parts per million is the strength of an appropriate chlorine solution for effective norovirus kill. And that translates to about 3/4 of a cup of bleach or chlorine to a gallon of liquid, a gallon of water. And by comparison, a typical bleach water sanitizing solution is about 1 tablespoon of bleach to a gallon of water. But this TB disinfectant shown here is extremely effective. It's also important to have dedicated equipment for cleaning up the accident so you're not spreading pathogens to other areas. And, of course, be sure to wash your hands and remove any protective clothing before resuming work tasks. This is so threatening in food operations. The FDA recently completed an extensive research study on norovirus and practices that would have the most impact in reducing norovirus transmission in a food establishment. The FDA presented their findings at the National Environmental Health Association's annual conference in Grand Rapids this past July, and they presented the 5 most effective prevention strategies that restaurants can easily implement today to reduce the risk of a norovirus outbreak. And here they are listed. First of all, frequent hand washing of norovirus, obviously. And secondly, more effective hand washing for better pathogen removal. Bare hand contact with ready-to-eat foods using some barriers such as gloves, utensils, or deli tissues was found to be effective in preventing norovirus transmission. Exclude sick food workers until they're free of vomiting or diarrhea for 24 hours. And touchless faucets and door handles in restrooms was also shown as a very effective procedure in preventing norovirus transmissions. So these norovirus indications would be great for restaurants to keep at top of your mind when looking to prevent breaks or norovirus transmissions in your operation. Restaurants are also exposed to potential chemical hazards in the restaurant environments. These can cause skin, nose, or eye irritations, allergic reactions, and burns. It's important that employees are trained on performing these tasks safely and understand the health hazards of the chemicals that they're working with. There should be a safety data sheet, SDS, on site for every chemical stored on the premises. These were formerly called material safety data sheets, but these safety data sheets are for the protection of employees from the chemicals they work with. These sheets would detail procedures for storing, using, and disposing of the chemicals safely, and first aid measures in case of an accident. And where the safety data sheets are located, and the SDSs should be stored in an accessible location, such as a right to understand station. Sit on the wall is all chemical containers should be labeled. Store all chemicals away from food areas. Follow manufacturer's instructions for handling, storing, mixing the chemicals, including the need for personal protective equipment. To avoid chemical dangers, do not use chemicals in unlabeled containers. Do not mix incompatible chemicals. For example, bleach and ammonia is a very dangerous combination that all staff should be aware of. Do not use empty water bottles or food containers for storing chemicals. G stands for Globally Harmonized System, and it's a relatively new system for labeling chemicals, according to OSHA. These OSHA regulations were developed in order to communicate the hazards of chemical products. So manufacturers are now required to label chemical containers with their type of risk using an international pictorial symbol of hazards. And these shown on the screen here are some of the symbols. They depict the potential dangers of that chemical, including explosive, flammable, oxidizing, corrosive, irritant, toxic, environmentally damaging properties. There are about 20 internal pictorial symbols that are now labeling chemicals all across the globe. Manufacturers, distributors, and food operations who use chemical products are expected to comply with this labeling and also conduct employee training. The stand station shown here conveniently houses SDS sheets in an accessible location, mounted on walls, so it's very conveniently located, and also provides employee training on the Global Harmonized System as required by OSHA as of October 2016. Training is essential for minimizing accidents in the workplace. Training would include proper use of equipment, proper use of chemicals, and mixing chemicals and applying chemicals, have an emergency plan in place with a list of emergency phone numbers. Employees should know who's in charge, where first aid supplies are located, what are the appropriate first aid procedures, and when to seek medical treatment. And it would be very helpful for every facility to have an emergency plan in place with emergency contact numbers, so if any sort of crisis does occur, whether it's a power outage, a water shortage, a chemical accident, or a foodborne illness outbreak, the appropriate agency or contact person is accessible to employees and management. And effective managerial control is very important in any food establishment. In this concept, the manager or person in charge takes control of situations in an operation, supervises employees and their procedures every day. managerial control includes monitoring not only the food safety within the facility, but also the safety from workplace accidents that may affect employees or customers. Active managerial control can help keep employees and guests safe from accidents and injury or a foodborne illness outbreak and your business running successfully. I think at this point, if there are any questions, we will be pleased to take them from you.
Thank you, Cindy, for that informative presentation. We did have quite a few questions come in. I'm just pulling them up here real quickly. The question was, is if there's gloves that are contaminated with norovirus, can they still be transmitted? Can they transmit the virus?
Yes, definitely. If gloves have been with norovirus, they should be disposed of immediately, hands washed, and then put on a new pair of gloves.
I have quite a few other questions that came in with norovirus, so I'll just kind of see if there's any, pull that all together.
Okay.
When a customer vomits in our lobby or dining areas and we clean it up right away, after we mop the floor, should we be bleaching the mop buckets and mops and try to kill the pathogen that may be still lingering? Or is the floor cleaning enough? What would you recommend to do with the equipment after cleaning up after a hazard incident?
It's recommended the equipment be sanitized as well or disinfected for norovirus anyway. On occasion, someone will vomit. It may not contain norovirus, but the FDA and CDC recommend that we treat any vomiting event as a norovirus event. So handle all equipment that are used in the cleanup procedure as potentially contaminated with norovirus, and they should be disinfected with a clean or peroxide disinfectant as well.
Another question is regarding employees that are asymptomatic of norovirus infection. Can they still transmit the virus?
They can. If someone is asymptomatic, they can still transmit the norovirus through their poor personal hygiene practices, through bare hand contact. They still could be shedding norovirus in their fecal matter, even though they don't show any symptoms, which is why it's very important to put some other barriers in place. If somebody's asymptomatic, they could be easily working around food. We have additional barriers such as wearing gloves while handling ready-to-eat foods. That's another precaution that can help in an asymptomatic individual.
One more question here on norovirus that we'll take is how long will norovirus remain viable on surfaces such as toilet handles or tabletops and things like that?
Some studies have shown that norovirus can survive up to 2 weeks in fecal matter, but up to, I think it's 3 days, 72 hours on non-food contact surfaces, such as floors, even carpets, can survive for up 2 to 3 days.
Question about the kitchen staff wearing gloves. Are they supposed to wear blue gloves, or is there a specialty type of glove that should be worn when they're wearing food, handling food? Or any kind of regulations around that people should be mindful of?
No, any food-grade glove would include a nitrile glove, polyvinyl glove, acceptable. It does not have to be blue. It can be blue, but it doesn't have to be. Latex gloves are, even though they're not against regulations, they tend to be discouraged from use, latex, because of potential latex allergies in customers and staff. But food-grade glove is acceptable in a food operation.
We have a couple questions around OSHA requirements. So just to start out with, what about eye wash stations? Are those required by OSHA in restaurants?
OSHA does not specifically state eye stations are required. They say because restaurants are considered general industry, it's up to the food establishment to determine what their particular risks are. So if someone does have an extreme risk for eye injuries because of certain procedures they're doing, it's up to them to install an eye wash station. It really is up to the food establishment, the restaurant, to determine their level of risk for eye injuries.
And another question regarding OSHA requirements on emergency training. Is it required in any languages other than English?
I'm not sure about that. I think it is available in a couple of different languages. Jeff, aware of that requirement for language? Jeff can hear me. We can get information on that and get back to you if you like.
Okay. And, another question around workers resuming work after they've been sick, whether it was vomiting or diarrhea or anything else. Is there any kind of oral verification or doctor verification required, or is it just kind of on your honor?
I guess it's kind of on your honor, and it also depends on the state. Certain states will require a health department to give permission for someone to go back to work or require a doctor's note. The FDA food code simply says employees should be restricted or excluded from work for 24 hours, so that would imply the honor system. But this is why having a food employee reporting agreement and illness policy in place in a food operation is so important, so the employee knows ahead of time what's expected of them, that they do need to be excluded for 24 hours, and be honest about returning to work. They need to be symptom-free for 24 hours. Return to work.
And another question kind of around OSHA or requirements in a restaurant about first aid certification. What are the requirements for restaurants about having people on staff who are first aid certified?
Aid certified. I know that that term I'm not really sure is, I'm not quite familiar with that term. I know that choke sitter or CPR courses are required in some states in food establishments. I'm not sure if OSHA requires training on first aid, although that seems to be implicit in using a first aid kit. So actually I'm not sure if OSHA requires that or if that's just an internal food establishment requirement that's understood.
Okay. Just a couple more questions just for reclarification on cleanup. So is there any kind of particular disposal of clothing or gloves, or how should a carpet be cleaned? Any kind of best practices around cleaning procedures after a vomit or a diarrhea incident in a restaurant?
So disposable clothing or aprons should be worn, a hair restraint, a shower cap or restraint to protect your hair. Gloves, of course, should be worn, and these should all be disposable. And part of your question was cup of carpet, other
carpet. Yeah.
Cup of carpet is a little bit challenging because if someone's using a bleach and water or a chlorine solution on carpet, of course the current is the bleach of the fabric itself. So a non-chlorine disinfectant, a TB disinfectant, or another EPA-registered disinfectant may be used to sanitize, disinfect the carpet that could contain norovirus.
Any particular procedures people should follow when disposing of the gloves or the clothing or any other items used? Like hazardous waste bags or anything like that?
There are hazardous waste bags that can be used. Some operations consist their hazmat pickup, and they dispose of the gloves, the disposable aprons, the hair restraints, a dedicated hazardous waste bag, and picked up. And that would probably be more required of a blood spill, a bloodborne pathogen type of an accident. For norovirus and vomiting accidents, just general disposal in the trash where no one can access it, and immediately dispose of that trash. And of course, wash your hands after finishing the cleanup procedure.
we have a question in here about proper food handling procedures. It specifically asks about MRSA, but just in general, what are some proper and tips and best practices for food handling in preparation?
In general, in operation, hands should be washed before handling any type of food. Even if you're going to be cooking that food, whether a steak or meat or chicken or making meatballs, hands should be washed before handling any food. And bare hand contact should be avoided with any cooked, ready-to-eat foods. So gloves are recommended with any ready-to-eat foods, some other barrier such as utensils, tongs, spatulas, so that you're not transmitting any potential pathogens from your skin to that food. And we're not just talking about norovirus here, we're talking about staphylococcus as well. 50% of healthy individuals have shown to have staphylococcus on our skin, and staphylococcus also produces a toxin. So someone, even the healthy, could transmit their own staphylococcus and toxin to the food they're making. So ready-to-eat foods, ones that are not going to be washed or cooked further before serving, are the ones we really want to protect from any pathogens originating anywhere, whether it's people or norovirus.
We have a couple questions that have come in around cuts and bruises and things like that. So in terms of the liquid Band-Aid, is that something safe to use in the workplace, or should we use more conventional Band-Aids? And also about,
I'm sorry.
And also just how it relates to OSHA. So what cuts and how should they be covered per an OSHA if an inspection comes in?
So cuts of that kind should be covered with a bandage, whether it's a liquid bandage or a physical cloth bandage. That should then be covered with a glove or a finger cot, or if it's on their arm or leg, with clothing. So just wearing the Band-Aid or bandage is not enough. Any kind of bandage should be covered with an additional or finger cot or clothing.
Okay. Another question is really specific, is about wearing gloves when you're washing potatoes and potatoes. Is that something that's true?
Actually, no. So washing vegetables that are going to be cooked further are not required to have gloves. You can wash fruits and vegetables with your bare hands, but would also actually include salad vegetables. You can wash fruits and vegetables with your bare hands. If they're going to further cut or cover, then gloves would go on when you're going to prepare the salad or the fruit salad. But washing potatoes, to go to your original question, you do not need to wear gloves for that.
Okay. And another OSHA requirement around first aid kits. Should those be kept in a locked office, or is it to be left out, still be locked? What are OSHA requirements around first aid kits?
They should be accessible, convenient, accessible location. So whatever that means to you. If a locked office or a locked cabinet is convenient and accessible, that's okay. Can alternatively have a first aid kit mounted on the wall right in the kitchen, accessible to everyone. So there's a little bit of leeway there.
Okay. We have time probably for just maybe one more question here. What does the OSHA training do for employees on a GHS system, and how can they do that?
How can they do that? Well, the OSHA training is included in the Right to Understand station that Ecolab offers. It trains employees on handling the chemicals safely. It trains them on being able to identify the international symbols of hazards and how to communicate these hazards within an operation that exists with the chemicals that they're using. You can also contact OSHA and probably able to get a copy of their training to deliver to employees, but it is conveniently located in the Right to Understand station as well that Ecolab carries.
Okay. We have quite a few questions that are product specific, and so we will follow up with folks on those individually. We do receive your questions and who you are after the seminar, so we will make sure we follow up with you directly on those particular questions. As you can see on the screen, if you would like continuing education certificate, there is a survey at the end of the seminar, which you can check yes, and we'll make sure that you get those particular notification from our team as well. Is there anything else that you want to say, or are we?
No, I don't. I guess we're all through. I want to thank you all for participating today. I hope it was informative and helpful, and I look forward to working with you all again sometime.
Okay. I actually just have one question that came in, so I'll just read this one too because it's with a different outside restaurants actually. How should isolation trays be handled in a nursing facility? If you're willing to take that one, Cindy, yet.
Isolation what?
Isolation trays in a nursing facility.
Isolate trays?
Mm-hmm.
TIS? I'm not familiar with that term, so I hesitate to answer that.
Okay. Well then, we'll look and we'll follow up with this person individually as well.
Okay.
So
thank you.
Thank you, Cindy, for your time today. This concludes our webinar. As you can see, we have another food safety, public health matters webinar coming up, very timely topic on flu prevention. It is next Wednesday, the 29th at 10 a.m. Central Time, 9 a.m. Eastern Time. You can send an email to the email to fsswebinars@ecolab.com, and we'll make sure you get an invitation so you can register for that particular webinar. A recording of this presentation will be available on Monday, November 20th, and that'll be available on Ecolab's website under Expertise and Innovation Resources and Food Safety Webinars. You'll also receive a notification about that as well. This is actually our last Food Safety Matters webinar for 2018, so we'll be working to get together a robust and interesting 2018 calendar, so you can watch your inbox for details on that. You can also register on ecolab.com to receive further updates. Again, thank you for joining us today, and we look forward to speaking to you at our next webinar. And if you have questions, there's an email on the screen you can send them to. Thank you very much, everyone, for your time, and this concludes Food Safety Matters webinar.